The term glycemia indicates the concentration of glucose in the blood, a sugar that is essential for the correct functioning of the body and represents the main source of energy preferred by the brain and muscles. Nutrition plays a crucial role in managing glycemia, as what we eat can influence blood sugar levels. Not only that, a balanced diet can help prevent glycemic spikes and promote better control of diabetes or reduce the risk of developing it. In fact, there are some foods that help keep glycemia under control. But which are they? Let's go see them. Whole oats. Avena sativa is a herbaceous plant native to Asia Minor and belonging to the grass family. Its ears produce a cereal rich in fiber and nutrients, including proteins, B vitamins, and essential minerals, such as magnesium, iron, phosphorus, and zinc. Oats, especially whole oats, have a relatively low glycemic index, which means they cause a slower and more gradual increase in blood sugar levels, thus avoiding sudden glycemic spikes. Several studies have shown that whole oats also help reduce blood sugar and cholesterol thanks to their soluble fiber content, particularly beta-glucans. These are a group of indigestible polysaccharides, which are found in the cell walls of fungi, yeasts, algae, and various cereals, including oats. These natural fibers appear to create a sort of membrane in the small intestine that limits the absorption of sugars and other micronutrients, thus lowering blood sugar and insulin levels, as well as having positive effects on metabolic and cardiovascular health. According to a study conducted at the Federal University of Lavras in Brazil, beta-glucans have also shown beneficial effects on the health of patients with type 2 diabetes, particularly in improving the lipid profile and reducing glucose levels. Cinnamon. Obtained by processing the branches and woody parts of the plant, cinnamon is a genus of evergreen trees, about 10 to 15 meters tall. Originally from Sri Lanka, cinnamon was one of the most precious and sought-after spices in ancient times, so much so that it was reserved only for emperors and kings. Today, however, it is used in cooking to flavor sweets, drinks, and savory dishes, as well as in cosmetics and medicine, thanks to its numerous beneficial properties for health. Some studies suggest that cinnamon can help reduce blood sugar levels and increase insulin sensitivity. This means that cells will respond better to insulin, using glucose more efficiently for energy. These effects are attributed to the polyphenols in cinnamon, which also have antioxidant properties, and to cinnamaldehyde, also known as cinnamic aldehyde. It is an organic compound responsible for the characteristic smell and flavor of cinnamon. Clinical and animal experiments have confirmed its clear anti-diabetic effects, such as regulating blood sugar and lipids and improving insulin resistance. Several studies have also evaluated the hypoglycemic effect of cinnamon in patients with diabetes, but have shown conflicting results. A study conducted by some Iranian researchers, for example, recorded an improvement in blood sugar and lipid profile of patients with type 2 diabetes following cinnamon supplementation. Not only that, it has also been shown to reduce systolic and diastolic blood pressure in adults. Legumes. Legumes are a large category of edible seeds of numerous plants belonging to the Leguminosa family. Known for their high content of vegetable proteins, fibers, vitamins, and minerals, legumes are the basis of the new food pyramid of the Mediterranean diet. Some of these are beans, chickpeas, lentils, peas, and soy. Although legumes contain carbohydrates, they do not cause sudden increases in blood glucose levels, as their protein and dietary fiber content slows down the absorption of glucose by the body. The soluble ones in particular have a hypoglycemic action, thanks to their ability to form a viscous solution, a sort of gel that slows the passage of sugars in the intestine, keeping blood sugar levels stable. Insoluble dietary fibers, on the other hand, contained in legumes, influence the release of some gastric hormones, including ghrelin, the hormone that stimulates appetite. As Harvard University points out, a cup of beans or lentils a day, when combined with a low glycemic diet, can help lower blood sugar and blood pressure, as well as reduce the risk of coronary heart disease in patients with type 2 diabetes. Apples. Originally from Central Asia, the apple tree is one of the most widely cultivated fruit trees in the world, and there are hundreds of varieties which are distinguished by the flavor and color of their fruit. In addition to having anti-inflammatory and antioxidant properties, apples have been shown to have a hypoglycemic action. This is because they are rich in soluble dietary fiber, such as pectin, and insoluble dietary fiber, such as cellulose and lignin, which help slow the digestion of sugars, preventing sudden spikes in blood glucose levels, as well as improving intestinal regularity. Apple peels also contain fluorizin, a substance that can reduce plasma glucose levels, acting in a similar way to some drugs used to treat diabetes. According to a study conducted in Japan, eating an apple before a meal can be a simple and effective strategy to manage the glycemic response in normal subjects and in those with impaired glucose tolerance, thus improving postprandial hyperglycemia. Apples are in fact among the recommended fruits for those suffering from diabetes, thanks to their low glycemic index and their dietary fiber content. Nuts. Nuts are a large family of seeds, usually covered with a hard and inedible shell. Some of these are almonds, walnuts, peanuts, cashews, and many others. They are an excellent source of fiber, vitamins, and good fats, including monounsaturated and polyunsaturated fatty acids, and in particular omega-6. Various epidemiological and clinical studies have indicated that nuts can play an important role in glycemic control, thanks to their content of bioactive compounds. Fibers and polyphenols, on the other hand, can have an anti-diabetic effect by positively influencing the composition of the intestinal microbiota. A study conducted by some Indian researchers has shown that consuming about 20 grams of almonds 30 minutes before main meals helps improve blood sugar levels, especially among people with diabetes. Walnuts, on the other hand, improve insulin sensitivity and reduce the risk of developing type 2 diabetes, as well as reducing levels of bad cholesterol. In conclusion, we have seen that nutrition and glycemia are closely linked, since what we eat directly affects blood sugar levels. Therefore, following a healthy and balanced diet, favoring the consumption of low glycemic index foods can help keep blood sugar levels under control, thus reducing the risk of developing metabolic diseases, such as type 2 diabetes.